Hey everybody, my name is Christian Nargiso, and today I'm going to teach you about a medical condition called hydrocephalus. Hydrocephalus happens when too much fluid builds up inside the brain. This extra fluid creates pressure that can cause a lot of problems if it is not treated properly and correctly. It can affect babies, children, and even adults. But the good news is, with early detection of hydrocephalus and good treatment, many people do very well. What is hydrocephalus? Normally, our brains have a special fluid called cerebral spinal fluid, or CSF. It moves around the brain and spinal cord, keeping everything cushioned, lubricated, and protected. But sometimes, this fluid does not properly drain out of the brain. Picture blowing up a balloon inside a box. The pressure builds up and starts to push on everything inside. This is what happens inside the skull when hydrocephalus is present. And that pressure can damage the brain if it is not handled quickly and properly. Symptoms of hydrocephalus. The symptoms can depend on a person's age. In babies, we might notice a head that is larger than normal or a soft spot on the head that sticks out. Babies may be also unusually fussy or sleepy. In older children and adults, symptoms can include severe headaches like migraines, frequent vomiting, trouble walking, memory problems, or sudden changes in thinking or behavior. Causes of hydrocephalus. There are a few causes of hydrocephalus. Sometimes it's present at birth because of a brain development problem. It can also happen after a severe head injury, infections like meningitis, or because of a brain tumor. And in some cases, doctors actually don't know why it happens. Treatment and living with hydrocephalus. The main treatment is surgery. Most people with hydrocephalus have a shunt placed in their brain. A shunt is a little tube that goes inside of your body to drain the extra fluid that is stuck inside of your brain or on the outside of your brain, causing pressure on the inside. But the shunt usually is placed here or anywhere around the head to drain the fluid, and it goes through the digestive system to be absorbed and expelled. But another option is a surgery called ETV, where doctors create a new pathway for the fluid to flow normally, and they don't have to really go inside of you like that. After treatment, many people with hydrocephalus live full and active lives just like you and I. Although regular checkups are important to make sure everything is in place. So remember, hydrocephalus is a serious condition, but it can be treated successfully. Knowing the signs and getting help quickly makes a big difference. Thank you for listening today. I hope you learned something new and important about hydrocephalus.